As a chain of 6 hospitals, ABC Healthcare shares its patient population across its facilities. Their current process of paper medical charts has caused deficiencies in patient care, provider and end-user satisfaction, and created financial risks based on breach violation possibilities. In this presentation, the author will outline some of the issues that ABC would like to address and rectify by purchasing an electronic health record, EHR, and the process by which a system will be evaluated and chosen. The author will also summarize some of the key processes in analysis and the impact on decision-making and finances the system will make. ABC Healthcare hopes to address ongoing issues regarding patient and provider satisfaction, as well as operational issues that are putting the organization at financial and reputational risk. Currently, patients can be transferred or scheduled at facilities with specific specialties. The paper medical records system ABC uses entails paper documents that are physically transported between departments and facilities. For billing purposes, records are faxed or mailed to the insurer. What this process has highlighted is that there is a delay and break in the continuum of care because providers cannot proceed with care until the medical records are physically delivered to them so they can review patient history. Physicians are then left at a risk of not addressing a condition properly, which can result in an adverse event for the patient as well as a reputational and licensing risk for the provider. Paper medical records also cause a delay in ABC receiving reimbursement from insurers. Faxes or mailings not making it to the intended insurer results in delays in the insurer's ability to process the claims. Finally, paper records that can be lost or land in the hands of the wrong recipient result in HIPAA breaches. These privacy violations have to be reported to state and federal agencies and can result in fines. For all these reasons, ABC Healthcare is embarking on the purchase of the new EHR system. While this new system will be of significant cost to purchase, Campanella, Lovato, Marone note that considerable cost reductions are achievable through improving quality of care and reducing harm to patients. One of the first steps ABC will take is to conduct a risk analysis. The purpose of the analysis is to determine what and where the risks are. This means looking at patient care risks, employee risks, and financial risks. The system that is chosen will have to have the capabilities to mitigate the risks that were identified. There will be multiple steering committees that will give input by defining how they need to use the system, what they need to view, and what data will need to be extracted. However, a key component in choosing the system's functions will be options and mechanisms that meet the HIPAA security rule. This rule requires all EPHI that a healthcare professional creates, receives, maintains, or transmits is protected against any reasonably anticipated impersonal uses or disclosures. Drummond, Cromartie, and Battersby. So ABC will not only ensure that the system has the capabilities defined by the steering committees, but safeguards such as encryption, password-based accesses, and role-specific access into parts of the EHR. ABC will also have to create an auditing and monitoring system where accesses to the EHR are audited for proven business purpose and monitoring of where all EPHI migrates to in and out of their network. The final component is the policies and procedures. ABC's attempt to follow HIPAA will only work if all staff is thoroughly educated on HIPAA guidelines and understand the role they play in preventing privacy breaches and unauthorized disclosures. Without all of these points being addressed in the risk analysis, ABC will leave itself open for HIPAA violations leading to fines and litigation. Healthcare decision-making using the SDLC. Once the outcomes of the risk analysis have been reviewed, a step-by-step plan of the stages of the system development will have to occur. Using the system development lifecycle, ABC will be able to move from evaluating the risks and needs of the organization and its current system to evaluating the phases of the system. Planning and analysis is the first phase, where steering committees and subject matter experts examine the organizational needs to formulate how to implement the system and outline the data security infrastructure. Next, we move to the design phase, where individual systems are evaluated to see what their capabilities are. The third phase is implementation, where the workflow processes the actual installation, training of staff, and testing how the system and extraction of data works. This phase involves the most manpower and will take the longest to complete. The final phase of the life cycle is support and evaluation, where staff will be surveyed with a 10-question survey to assess the usability of the system and create benchmarks to identify areas of success and improvement. The key to the SDLC is that each phase focuses on ensuring the system will meet all the needs that were identified within the budget and time constraints ABC Healthcare has. Without the SDLC process, an organization could likely end up with a system that is ineffective for their needs. The impact of technology on cultural factors in healthcare provisions and decision-making. New technology can be intimidating to end users, but it can also give healthcare workers confidence that their patient data is secure and available when needed. This sentiment sets a positive work culture tone and allows decisions to be made with assurances that the needs of the providers and patients are being met. Providers have voiced concerns that the added time spent in data entry in an electronic medical record will slow down their work. However, an EHR offers one repository for all data that all providers can access in a matter of seconds. Given this speed, providers can review their patient statistics and test results, as well as request specialist consultations and review the consults assessments in real time. The paper chart system ABC Healthcare used could not provide such real-time data access. Providers had to wait for paper charts to be delivered to them and test results to be physically added to the chart file. This delayed care and broke the continuum of care. As a healthcare organization, this left ABC open to many patient care risks. The other delay came in handwritten notations being transcribed to correlate to billing diagnosis codes and paper charts copied and mailed to the insurance providers. Whereas an EHR transmits its data in a matter of minutes, the paper chart system could take days to weeks to get to the insurer, which inevitably delays reimbursement to ABC. The roles and responsibility of key players. To obtain the most optimal system, ABC will have key players involved in the system evaluation process. Waldo Notes, the Chief Information Officer, CIO, leads the project and acts as a policymaker, educator, strategic planner, and expert on regulatory federal, state laws, and is ultimately the risk alleviator. The Chief Financial Officer, CFO, will work with the CIO to formulate budget required for purchase and staffing needs. Together, they will negotiate the costs of all components needed in the system. The IT super users and the data security team will be trained by the CIO and will aid in enforcing policies and procedures that meet HIPAA guidelines and will become the point persons to handle any technical and user issues as they arise. Johnson and Brownlee state, developing educational tools and hiring key personnel will be critical to success. Finally, the input of the staff and end users during implementation will allow the CIO and the data security team to make any alterations and upgrades to the system needed to ensure ongoing proper utilization. Adopting and implementing data governance is meant to improve patient care. For ABC, enterprise data is very complicated and comprehensive due to all the various types of care that are housed in the EHR. From physician and RN notes to test results and appointments, ABC will have to ensure that their enterprise-wide data system will be compatible across their inpatient, outpatient, and pharmacy departments at all 6 facilities. Migrating the raw data from each system into one standardized base without losing or altering data will be a challenging task as well. However, once all the data is consolidated into the EHR, ABC will be able to manage the raw data and extract reports, benchmarks, and statistical vitals to improve patient care. There's an essential task for IT department, quality risk departments, and billing departments because the data that they extract will show the areas in need of improvement. The paper charts previously used were not compatible with accurate data extraction, so the technology of an EHR will be invaluable to patient care and overall hospital operations. When the data noted in the previous slide is processed, organized, and evaluated, it becomes a health information that ABC will use to address areas of improvement in the organization and within the system. Johnson and Brownlee state a key element that all health systems should be developing is the ability to leverage the resources and capabilities of the system to provide integrated patient care. One of the key purposes ABC chose to purchase an EHR was so capturing the data is useful when it is translated into the areas where enhancements are needed to make the system truly efficient. Whether it be patient care improvements such as faster admissions or timely assessments from specialists or quicker access into the system by end users, all of these items are addressed from health information that the raw data provides. This will provide ultimately the medical knowledge that will aid health professionals in decision making. Campanella, Lovato, Marone. As with any organization, policies and procedures are the foundation of how it functions. With the ePHI that ABC's EHR system will be housing, best practices must be integrated as policies that are adhered to. The system must have encryption and firewall capabilities to properly secure the integrity of the data. All users must have logins with passwords. The data security team must provision access based on roles, needs, and also ensure accesses are disabled when the staff member leaves the organization. Having these elements in place does not mean that the data is protected unconditionally, so an ongoing auditing and monitoring process by the data security team and the privacy department must be in place. Whether it be human error, an IT glitch in migration, or a hacker, there will always be risks that must be monitored. The final practice needed is a downtime procedure. Does ABC have a backup system or a process to shift to manual health record maintenance? If the answer is no, then the safety and integrity of the data are completely compromised. A modern-day option is cloud storage. Drummond, Cromartie, and Battersby find uploading data to the cloud allows for convenience in the form of access of data in case of local computer failures. The initial investment for ABC's acquisition of an EHR will be substantial because the cost will include the actual purchase of the system along with the creation of an infrastructure that was noted previously in terms of the CIO, super user teams, education, and other departments that are related to the EHR. It will also include purchases of monitors, mobile computers, and handheld devices. However, Jivan notes hospitals may expect a reduction in costs attributed to the inefficiencies in the production process, in addition to a reduction in overall costs attributed to normal hospital operations. As a single repository streamlines the processes, reduces the number of staff, increases the accuracy of data, and enhances billing and reimbursement times. The staff hours that were previously incurred with physical transportation of patient records throughout the hospital are eliminated. Faxes, printers, paper use, and courier services to send records are also eliminated. And most importantly, the cost of fines and litigation due to human error resulting in PHI breaches are mitigated. Implementing the new EHR will show the benefits of the system will outweigh the initial investment. The board will want to know that the system chosen by ABC meets the best interests of the organization and the patient. With growing scrutiny from government agencies regarding patient data being breached, the board may ask, how will we handle ePHI data breaches? This is a valid question, as Zamoski noted, that patient medical data is more valuable than a financial record on the black market. There's so much more information that can be used for identity theft purposes. ABC will have to show that if data is breached, the data security team will be able to track where and who accessed it, as well as show that the encryption process was in place before the disclosure occurring will make the data unreadable to the unintended recipient. Another concern will be the safety and access to the current charts and data during transition. ABC will be using a phased method for this conversion. Therefore, starting with the lower risk departments, charts will be copied and the copies will be used for data entry into the new system. Therefore, original records can be used as access as done historically. Finally, the board will want to know, what does the patient, who is ultimately the customer for ABC, gain from an EHR? For the patient, there will be a faster time and care provided, the accuracy of their data, and the creation of a user-friendly patient portal. For these reasons, the patient can have confidence that the providers are looking at up-to-date accurate data, and they also can have access to their medical records, which allows them to advocate for their needs. In conclusion, the EHR system that ABC is evaluating for purchase will have many benefits. It will address the delay of care, provider limitations, and reimbursement delays that mitigate HIPAA violations. Using SDLC and conducting thorough risk analysis will allow the key leadership at ABC to negotiate and purchase a system that will address their needs and satisfy board concerns.